Lack of skilled and available health workers is a major challenge for Uganda's health sector, especially in remote parts of the country. To ensure that health workers are available and address human resource shortages and skill gaps, the USAID Strengthening Decentralization for Sustainability SDS program recruits skilled health workers under the PEPFAR-funded Human Resources for Health HRH initiative. Through this initiative, SDS recruited 1,212 health workers in 71 districts in both public and private not-for-profit health facilities. In Kaliro district alone, SDS recruited 14 health workers including nurses, midwives and laboratory workers.
Just before SDS came in, the government of Uganda had carried out mass recruitment of health workers for the health center 4s and health center 3s, and so there was a gap at the health center 2s. So when SDS came in, they helped us to improve the staffing at the health center 2s. And you know the health center 2s are the ones where most of the community is.
The waiting time has been reduced, especially in outpatients. They used to come here and wait for a long time because we were understaffed at that time. At least these 3 people who came in covered those gaps.
SDS partners with district local governments and Acclaim Africa Limited, faith-based organizations, the Uganda Catholic Medical Bureau, the Uganda Muslim Medical Bureau and the Uganda Protestant Medical Bureau to improve human resources for health. Sister Mary Goreti Namboze heads Budini Health Center 3 in eastern Uganda. She is one of the 3 health workers that SDS recruited here. Since 2013, when the program began supporting the facility, health services, especially for children and pregnant women, have steadily improved. With funding from PEPFAR, the USAID SDS program recruits health workers, pays salaries and allowances for selected health facilities. The program also conducts routine staff in-service trainings, provides technical supervision and recognizes outstanding performance to further motivate the health workers.
I'm so grateful with the SDS. It has been doing its work very well. They kept on mentoring us. They had to know whether every month we've received our salaries. And another thing, they made the increment on our salaries. We are so grateful. Yes. Then I had a comment that though the contract is almost ending, they would have postponed it for the year at least, and it ends the other year.
And to ensure that these gains are sustained beyond the life of the SDS program, SDS works with district governments to include these health workers onto the national payroll. Of the 671 SDS recruited health workers seconded to the public sector, 46% were successfully transitioned onto the national payroll.
We have different phases in terms of how our programs go, and I think the next phase of working with the Ugandans at the decentralized level is going to be a more systems approach rather than a service delivery approach, so that we can actually make these systems work without our support over some period of time. And as a partner, Cardno has been incredibly responsive to USAID and all of our multiple needs as the program has expanded. And I think because it was such a successful program, we tried to take full advantage of it and expand its scope and its areas of operation throughout the country.
As the SDS program winds up activities, transitioning the remaining health workers onto the national payroll must be a priority for the government of Uganda. Strengthening Uganda's local government systems is a key mandate of the USAID-funded Strengthening Decentralization for Sustainability SDS program. Local government councillors play a critical role in their communities, but for some, the roles and responsibilities are new and they are not fully prepared for their duties. The Uganda Local Government Act requires that councillors are oriented and prepared to execute their mandate effectively.
There are many things we've been taking for granted.
That is why the program, in collaboration with the Ministry of Local Government and other partners, organized 2 rounds of tailored trainings for newly elected local government councillors and technical officers in 2012 and 2017. Known widely as Logic 1 and Logic 2, these trainings equipped local leaders with the skills and knowledge needed to improve health and social service delivery within their communities.
I appreciate the training because now I know I must have a business committee and get it functional. And I believe the next council is going to be on point.
During Logic 1 in 2012, which was co-founded by USAID and DANIDA, 325 trainings were conducted, benefiting over 28,000 local leaders. These inductions were completed in all the 111 districts. While in 2017, the SDS program conducted 48 trainings, benefiting 5,100 people in 15 targeted districts in eastern Uganda. Trainings focused on several areas including leadership skills building, financial management and budgetary processes, corruption mitigation, HIV/AIDS, gender and nutrition awareness, among others.
Actually, we didn't know what gender is, but now we know it. And we need to go and share it with our people in the village or communities.
In Bududa district in eastern Uganda, Sofia Nambuya Nabushaw is one of the 3 technical staff selected to participate in this training alongside the councillors. She is a sub-county health assistant attached to Bulucheke Health Center 3.
I was so grateful because the knowledge I got there helps me improve my area of work, and especially what I enjoyed the most was the diseases that are communicable. For example, we have TB was addressed there. HIV/AIDS, it was also inclusive in the program. And then malaria.
Sylvia says things are going to be done differently moving on in terms of improving health services in Bulucheke.
That training, personally, I benefited. And I came to realize that in my career, in my service delivery, there has been a gap. Nutrition was underlooked by the community members. So as I talk now, I've put it on, or I've included it in my work plan. We even need to make a budget.
SDS has been supporting Uganda's district local governments since May 2010 to deliver better health and social services across the country. To date, the program has implemented activities in 77 districts in Uganda.
The SDS has helped fill a very important gap in the public sector to get services to the people who need them.